Honorable world leaders, excellencies, ladies and gentlemen, my name is Edith Kimani, joining you from Geneva today, and I'm delighted to welcome you to the Gavi COVAX Advanced Market Commitment Summit, Break COVID Now. Now, today's event is hosted by the Chancellor of Germany, Olaf Scholz, and co-hosted by the President of Indonesia, Joko Widodo, the President of Senegal, Macky Sall, the President of Ghana, Nana Akufo-Addo, and the Chair of the Board of Gavi, the Vaccine Alliance, Professor Jose Manuel Barroso. I'll be guiding you through today's event together with the Minister of Economic Cooperation and Development of Germany, Svenja Schulze, who will now open the first session. The pandemic is not over. Minister Schulze, it's a real pleasure to join you today. Over to you.
Thank you. Thank you very much, Edith. I'm really delighted to be here today, joining you from Berlin. And Germany is pleased to co host this COVAX AMC summit with Gavi. We look proudly back at our long and strong relationship with Gavi and more recently, our cooperation in the global fight against COVID-19 through COVAX, the vaccines pillars of the ACT accelerator. We look forward to our continued collaboration so as to bring this pandemic to an end and ensure fair global access to vaccine, which is a key priority in our G7 presidency. The first COVAX supplied vaccines were administered in a lower income country just over a year ago. No more than 1.2 billion doses have been provided through the COVAX AMC to lower income countries around the world, narrowing the vaccine equity gap. But significant challenges still remain. Hundreds of millions of people, mainly in lower income countries, remain unvaccinated and unprotected, while the virus continues to evolve in uncertain ways. A major variant has been identified every 4 months on average since the pandemic was declared. And at the same time, a terrible new crisis has unfolded in Ukraine. Our thoughts are with the Ukrainian people and their families. In the last few weeks, many people have had to leave their homes, have suffered atrocities, or have lost their lives. Global economies are now facing another threat after already being shaken by 2 years of uncertainty and the pandemic. So, to overcome the pandemic and close the equity gap, we need to enable lower income countries to scale up their delivery systems and to ensure that they get the right vaccines at the right time. And this is what COVAX is working towards in 2022. One of the key lessons we have learned last year is that in order to be agile and flexible in our response to the pandemic, we need sufficient early resources. And this is why today we need to ensure COVAX can secure at least $3.8 billion from donors as part of wider $5.2 billion package of support for lower-income countries through the COVAX IMC. In January, at the launch of the 2022 COVAX AMC investment opportunity, several donors have already begun to answer COVAX call, making early initial pledges of $192 billion. But more need to be made today because we need to break COVID now and end this crisis. And I am delighted that the G20, the G7, and African Union have come together as co hosts for this summit. Let us hear from the Federal Chancellor of Germany, Olaf Scholz, the President of Indonesia, Joko Widodo, the President of Senegal, Macky Sall. Let us hear their commitments now.
2 months ago, we took a big step on our path to overcome COVID-19. At the BioNTech facilities in Marburg, Europe and Africa joined hands to jumpstart local vaccine production in Ghana, Senegal, South Africa, and Rwanda. New mRNA production sites are being established in these countries. They are urgently needed. So far, a new variant of concern has been detected nearly every 4 months. The next one could easily be more dangerous than the last. So let me put it very simply. Until we beat COVID-19 everywhere, we beat it nowhere. That is a fact and a responsibility for all of us. However, the global vaccination rate remains extremely unequal. Even now, less than 10% of citizens in low-income countries are fully vaccinated. Often high-risk population groups, such as the elderly or people suffering from chronic diseases, remain completely unprotected. The good news is we finally have enough vaccines. What we are experiencing now are different new bottlenecks. We are addressing them, for instance, by strengthening health infrastructures and building cold chains. Other challenges in Germany, but also elsewhere, are vaccine skepticism, disinformation, and fake news. There are still lots of myths surrounding virus and vaccines. From Malawi to Cambodia and elsewhere, we are therefore working with regional partners and campaigns all over the world to inform people directly about COVID-19 and the benefits of being vaccinated. Ladies and gentlemen, the pandemic is not over, far from it, and neither is our fight against it. Germany is the second largest supporter of the ACT Accelerator. In line with the slogan of our G7 presidency program, Progress Towards an Equitable World, we want to remain a leading contributor. That is why we are planning to support for ACT A and supporting measures with more than 1.3 billion euro in 2022. 660 million euro from that amount will go directly to COVAX. To meet our common goal of vaccinating 70% of the world's population, we all need to step up. That is why we are here today. So thank you all for your support and participation. And many thanks to COVAX and the Global Alliance for Vaccines and Immunization for their great work. Together, we will end the pandemic.
Yang Mulia Kanselir Jerman, Yang Mulia Presiden Senegal, Yang terhormat Ketua Dewan Gavi, keberhasilan COVAX dalam mendistribusikan vaksin ke 144 negara AMC telah memberikan kontribusi besar dalam penurunan jumlah kasus baru COVID-19. Namun, sepertiga penduduk dunia belum mendapatkan suntikan pertamanya, termasuk 83% penduduk di Afrika. Oleh karena itu, kita harus perkuat kerjasama dan solidaritas untuk mencapai target vaksinasi 70% penduduk tiap negara pada pertengahan 2022. Sebagai ketua bersama COVAX AMC Engagement Group, Indonesia akan terus bekerja mendorong akses vaksin yang lebih merata bagi semua negara. Untuk itu, saya mendukung inisiatif pendanaan baru COVAX di tahun 2022, termasuk peluncuran Pandemic Vaccine Pool hari ini. Sudah saatnya kolaborasi kita masuk ke babak baru. Kita perkuat gerakan vaksin menjadi gerakan vaksinasi. Kita tingkatkan kesiagaan menghadapi varian baru yang lebih berbahaya. Dukungan peningkatan kapasitas dan pendanaan merupakan kunci untuk pulih dari pandemi ini dan dapat mengatasi pandemi yang akan datang. Hal ini sejalan dengan prioritas presidensi Indonesia di G20. Arsitektur kesehatan global harus bertransformasi menjadi lebih cepat, lebih tanggap, dan lebih tangguh. Recover together, recover stronger. Terima kasih.
Monsieur le Président du Conseil d'administration de Gavi, Monsieur le Directeur exécutif de Gavi, Madame la Directrice générale de la facilité COVAX, Mesdames et Messieurs, je suis heureux de me joindre au chancelier Olaf Scholz en soutien à la campagne de mobilisation pour la reconstitution des ressources de l'initiative COVAX. Je salue l'engagement du chancelier Scholz en faveur de cette noble cause. Cette rencontre se tient alors qu'une nouvelle poussée de la pandémie Covid-19 sévit dans certaines régions du monde, après une période de reflux. C'est dire que l'urgence sanitaire est toujours là et que la lutte contre la Covid doit rester au cœur des politiques de santé publique. N'oublions pas aussi que d'autres pandémies, comme le cancer, le paludisme, le VIH-Sida et la tuberculose, continuent de faire des ravages à travers le monde. Il nous faut, par conséquent, accroître les efforts de financement de la recherche, de l'innovation et des infrastructures de santé publique. Je remercie les partenaires qui accompagnent les efforts de nos pays dans la promotion du vaccin et de la vaccination, comme récemment dans le cadre de l'initiative COVAX, dont le Gavi est un des acteurs majeurs. Mais bien avant, s'agissant du Sénégal en particulier, Gavi a considérablement contribué à la mise en œuvre de notre programme national de vaccination et de lutte contre la mortalité maternelle et infantile. En reconnaissance des services qu'il continue de rendre aux pays bénéficiaires, Gavi mérite d'être soutenu en tant que pilier essentiel de la solidarité internationale pour le vaccin et la vaccination. C'est pourquoi, à ma qualité de président de la République du Sénégal et président en exercice de l'Union africaine, je lance un appel à tous les pays et institutions partenaires afin qu'ils contribuent à la reconstitution des ressources de COVAX. Je souhaite plein succès à notre sommet.
I'm delighted to co-host this virtual Gavi COVAX AMC Summit with the Chancellor of the Federal Republic of Germany, His Excellency Olaf Scholz, and with other world leaders. I extend best wishes from the government and people of Ghana to you all. Excellencies, one of the important initiatives created to help win the fight against COVID-19 has been the COVAX facility. As the first country to receive COVID-19 vaccines from the facility, some 21.5 million doses from the COVAX facility, representing some 71% of total vaccines in the country, have been deployed to Ghana. We have, through this, vaccinated some 13.5 million people of our population so far. Just as we have been able to lift virtually all COVID restrictions in Ghana through low infection rates and increased vaccinations, the world finds itself in a favorable position thanks to COVAX and the collective efforts of the international community under the leadership of the chair of the Gavi board, Jose Manuel Barroso. Excellencies, in spite of this, many more people still remain unvaccinated and unprotected. And in the event of another wave of infections or a mutation of the virus, these people will be at great risk. We therefore need to renew further our commitment to support lower-income countries and support national COVID-19 vaccine objectives. It is for this reason that the 2022 Gavi COVAX AMC Summit is being organized to help raise some $5.2 billion United States dollars in urgent financial support for the COVAX, which we are all agreed has served all of us very well. Before I conclude, and whilst appreciating COVAX in COVID-19 vaccine supply initiatives, Ghana, Rwanda, and Senegal, in partnership with the German biotechnology company, BioNTech SE, are venturing into vaccine development and manufacturing. We're determined to become vaccine manufacturing hubs in sub-Saharan Africa. We want to achieve self-sufficiency in vaccine production to meet future national, regional, and continental needs for health security. The support of the international community in the realization of this goal will be deeply appreciated. I thank you for your attention.
Thank you. Thank you very much, Excellencies. Thanks to Olaf Scholz, Joko Widodo, Macky Sall, and the President of Ghana, Nana Akufo-Addo. Thank you very much, Excellencies, for sharing your commitments. The collaboration between the G7 and the G20 and the AU-EU partnership have been critical to address the pandemic, building on our strengths and learning from each other. Germany renewed commitment to COVAX and the ACT accelerator is a testament of our visions of fair and equitable vaccine access. I would now like to welcome the chair of the Gavi board, Professor Jose Manuel Barroso, whose leadership has been essential to COVAX. Professor Barroso, very warm welcome to you.
Thank you very much, Minister Schulz. Thank you. Very kind words. And also, if I may, a very special thank to our co-hosts, President Sall, President Widodo, President Akufo-Addo, for their valuable contributions, and to Chancellor Scholz from Germany for hosting this very important summit. As we have just heard, the pandemic is far from over. We cannot afford to be complacent because the virus continues to evolve. Even in the face of other pressing global crises, like the dramatic situation in Ukraine, COVID must remain a global priority. Dozens of lower-income countries are still struggling with their rollouts. With 2.8 billion people still unvaccinated, the virus continues to circulate. The threat of new and potentially more dangerous variants and fresh resurgences still hangs over us. Even now, we are seeing cases rise in some countries, with still over 10 million new cases and nearly 50,000 deaths each week. The only way to ever be certain that the worst is behind us is by preparing for whatever else COVID has to throw at us. That means limiting its ability to spread and mutate by ensuring that all countries achieve their national vaccination targets. Thanks to your generosity, COVAX is helping to make that possible, with on average 40% of people in AMC countries now fully vaccinated. We have so far delivered more than 1.4 billion doses, with nearly 90% of them going to AMC countries. However, in low-income countries, still less than 15% of people have received their first shot. Funding our investment opportunity, Break COVID Now, will help us close the vaccine equity gap by enabling countries to scale up their delivered systems and ensure they get the right vaccines in the right volumes and at the right time. This will make the progress made by previous investments sustainable, and also by allowing COVAX to prepare for potential future disruptions to its supplies. And by enhancing public health infrastructure and technical capacity of governments and local NGOs, it will help improve future pandemic preparedness. Ultimately, the first test of pandemic preparedness is to make the investments needed today to prepare for every eventuality of this current pandemic. I thank you for your attention.
Thank you, Professor Barroso. As you say, early investments today are essential for pandemic preparedness, and we cannot afford to have lower income countries at the back of the queue again. So it is with great pleasure that I now hand over to the Prime Minister of Japan, Fumio Kishida. As a long-standing partner for Gavi and leader in the fight against infectious diseases, Japan hosted the first COVAX AMC summit in 2021. Prime Minister, warm welcome to you.
ご参加の皆様、世界が新型コロナウイルスの危機に直面してから2年猶予、我々はこの間多くを学び、ワクチンという強力なツールを手にしましたが、今なお世界にはワクチン格差が残されています。この感染症を真に克服するためにも、世界のあらゆる国や地域でワクチンへの公平なアクセスを確保し、誰の健康も取り残さないことが鍵となります。今こそ我々の結束を行動で示し、危機を乗り越えるためのさらなる一歩を踏み出さなければなりません。我が国はこれまでに COVAX への合計10億ドルの財政的貢献に加え、4300万回分以上のワクチンを各国、地域に供与してきています。また、コールドチェーンの整備など、接種体制の強化やワクチン忌避対策などを目的として約 1.6 億ドルのラストワンマイル支援を計77カ国地域で展開しています。また、現下の新型コロナウイルスの変異への対応、さらには将来のパンデミックへの備えのために先般、セピに対する3億ドルの新規拠出を表明しました。さらに本日、ワクチンの公平なアクセスの実現を強力に後押しするためのさらなる貢献として、我が国はCOVAXに対し、これまで拠出済みの10億ドルの貢献に追加して、今時増資や取り組みの状況を踏まえつつ、最大5億ドルの拠出を行うことを表明いたします。世界の隅々までワクチンを届けるため、人間の安全保障の理念のもと、それぞれの国や地域のニーズを踏まえたきめ細やかな支援を行ってまいります。今後とも我が国は関係国や機関と緊密に連携してユニバーサルヘルスカバレッジの達成、そして新型コロナの克服に向けた国際的な取り組みを牽引していく決意です。ありがとうございました。
Thank you, Prime Minister, for Japan's renewed commitment to the COVAX AMC. We are very much encouraged by your personal determination to continue to provide leadership in ending this pandemic and addressing human security and universal health coverage. We will soon hear from the Prime Minister of Bangladesh, Sheikh Hasina, and the Prime Minister of Tunisia, Naila Bouden. But first, I am pleased to welcome the Secretary General of the United Nations, Antonio Guterres. Secretary General, the floor is yours.
I commend the government of Germany and Gavi for organizing this important summit. This gathering is a critical reminder that the COVID-19 pandemic is far from over. We are seeing 1.5 million new cases each day. Large outbreaks are spreading in Asia, a new wave is sweeping across Europe, and some countries are reporting their highest death rates since the start of the pandemic. Omicron is a startling reminder of how quickly COVID-19 can mutate and spread, especially in the absence of high vaccination coverage. Some high-income countries are preparing for their second booster doses, and yet 1/3 of humanity remains unvaccinated. This is a brutal indictment of our deeply unequal world. It is also a prime breeding ground for new variants, more deaths, and increasing human and economic misery. The next variant is not a question of if, it is a question of when. We are far from our target of every country reaching 70% vaccination coverage by the middle of this year. And with new variants emerging every 4 months, on average, time is of the essence. Supply is not the issue. Manufacturers are producing 1.5 billion doses per month, and thanks to its remarkable procurement, shipment, and delivery system, the COVAX facility and its advanced market commitment mechanism has managed to deliver 1.2 billion doses so far to countries in need. This proves that progress is possible, but the window is closing fast. Governments and pharmaceutical companies need to work better together to deliver vaccines to every person, everywhere, not just in wealthy countries. This means countries fulfilling and accelerating those sharing and donation commitments to COVAX with better quality of supply. And it means having strong national vaccine delivery systems at the ready, including efforts to counter disinformation and get vaccines into arms. I also call on countries to commit new funding for the ACT Accelerator and COVAX this year. And we need to help all countries prepare for future pandemics, multiplying the number of countries able to locally produce tests, vaccines, and treatments, so we can save lives quickly and equitably when the next variant or pandemic strikes. And ultimately, build stronger health systems that are accessible to all. Investments today will not only save lives, they will strengthen overwhelmed health systems for the future and help all countries move closer to sustainable recovery. The COVID-19 pandemic, it's not over, but it can be. Let's end it together.
Bismillah ar-Rahman ar-Rahim. Excellencies, distinguished participants, I thank Germany and Gavi for organizing the COVAX AMC Summit. The COVID-19 pandemic has reinforced the need for international cooperation to respond effectively to public health emergencies. The COVAX facility has offered us a global platform for the purpose. We must support this platform with necessary resources and expertise to deal with future pandemics. The impact of the pandemic could have been devastating in Bangladesh if we did not have a strong healthcare system. Throughout the pandemic, we were able to keep the infection at tolerable level, and now we see a drastic fall in the infection. So far, we have vaccinated more than 90% of our targeted population at free of cost. Our long-standing partnership with Gavi has been critically in achieving this success. We look forward to continued support from the COVAX AMC mechanism. I firmly believe that vaccines should be considered a global public good. Unfortunately, there are some countries still remain far from achieving their vaccination targets. These countries deserve special attention and support from the international community. I call upon all stakeholders to work together to help reach vaccination targets in all countries. I also urge the development partners to increase their contributions and vaccines to COVAX AMC. I would like to ensure that my country is ready to do its part to ensure vaccine equity and committed to working always with Gavi and COVAX AMC. I thank you all.
بسم الله الرحمن الرحيم. السيد المستشار أوليف شولز، السيد خوسيه مانويل باروزو رئيس مجلس الإدارة إدارة التحالف العالمي للقاحات، السيد سيث بيركلي المدير التنفيذي للتحالف، أصحاب السعادة والمعالي. اسمحوا لي في البداية أن أعرب عن تقديرنا العميق لجهود ألمانيا والتحالف العالمي للقاحات ومبادرتهم بعقد هذه القمة التي نأمل في أن تتوفق إلى حشد العزائم وتعبئة الموارد اللازمة للمضي قدما في الجهود الدولية لمكافحة جائحة كوفيد-19 من خلال تمكين كافة الدول والشعوب دون استثناء من اللقاحات. لقد دعا سيادة رئيس الجمهورية قيس سعيد منذ الأسابيع الأولى للجائحة إلى تضامن دولي فاعل لمجابهتها ورفع عديد التحديات التي فرضتها على كافة دول العالم، ولم ندخر جهدا خلال عضوية تونس في مجلس الأمن وصلب كافة آليات التعاون متعددة الأطراف في تحفيز كل الجهود الدولية وحشدها من أجل توزيع عادل وشامل للقاحات حتى لا يتخلف أحد عن الركب. وعلى الصعيد الوطني حرصنا على التفاعل بالسرعة المطلوبة مع الجائحة باتخاذ جملة من التدابير الاستثنائية الاقتصادية والاجتماعية ومن الخطوات العاجلة لتوفير اللقاحات والمعدات والتجهيزات الطبية المتنوعة من خلال تعبئة كل الموارد الوطنية المتاحة وتشريك الجيش الوطني ومنظمات المجتمع المدني والتونسيين في الخارج. وأود أن أنوه هنا بالخبرات والكفاءات التونسية التي أثبتت قدرتها على التعامل مع جائحة كوفيد-19 وبقية الطوارئ الصحية، مما أهلها لاستيعاب التقنية الخاصة بالتلقيح واحتضان تونس لأحد مراكز تصنيع التلقيح في إفريقيا. ولا يفوتني أن أغتنم هذه الفرصة لأجدد شكري وامتناني لكافة البلدان الشقيقة والصديقة والمنظمات الأممية والدولية، وعلى رأسها منظمة الصحة العالمية واليونيسف والتحالف العالمي للقاحات التي عاضدت جهودنا الوطنية ووقفت إلى جانب تونس في الظرف الوبائي الصعب، مما ساهم في تجاوز المرحلة الوبائية الصعبة التي عرفتها بلادنا. وفي الختام أجدد التزام تونس بالتضامن والتعاون الدولي كخيار وحيد لمواجهة التحديات المشتركة، سواء تعلق الأمر بالإتاحة العادلة للتلقيح ضد الكوفيد لكافة شعوب العالم أو في التعاون وفي التعافي من مخلفات الجائحة على اقتصادياتنا ومجتمعاتنا. وشكرا لكم على حسن الإصغاء.
Thank you, Your Excellencies, for sharing these powerful insights. Ending the pandemic is a critical common challenge for the world, and I'm glad that we are all here today to address it collectively. So, rounding up the first session, we will now hear from the Secretary of State of the United States of America, Antony Blinken.
Hello, everyone. I'm delighted to join this summit to support the Gavi Alliance in its mission to increase global access to safe and effective COVID-19 vaccines through the COVAX Advanced Market Commitment. I'd like to thank the German government for hosting this summit and our co-chairs, Svenja Schulze, the German Federal Minister for Economic Cooperation and Development, and Jose Manuel Barroso, the Gavi board chair. I'd also like to thank Seth Berkley for his tireless work as the Gavi CEO. We've made significant progress to accelerate equitable vaccine access and get shots into arms. By February, COVAX had provided more than 1 billion vaccines to more than 140 countries, with 88% of those contributions going to low and middle income countries. But we've still got a lot of work to do to protect people at risk and reach the World Health Organization's goal of vaccinating 70% of the population of each country and economy. Hitting that target is critical to stopping the virus from spreading and mutating and ending the acute phase of this pandemic. That's why the United States is announcing a $1 billion loan to Gavi to help close the gap between commitments made to COVAX and the delivery of the funds. This emergency financing will help Gavi accelerate efforts to provide equitable vaccine access by purchasing vaccines, syringes, and other essential supplies to meet urgent needs. Our new investment will build upon more than $19 billion in assistance that the United States has already sent to countries and organizations fighting COVID. We're also committed to sharing 1.2 billion vaccine doses, free of charge. As of last month, we delivered 500 million doses to that goal. And we'll continue to work with partners to expand access to testing and therapeutics, support healthcare workers, strengthen global health infrastructure, so that we can detect, prevent, and respond to future infectious diseases. We've already seen what we can accomplish when we work together. At the end of July 2021, as the Delta variant spread, fewer than 5% of adults in Vietnam had received at least one dose of a COVID-19 vaccine. Support from COVAX delivered millions more doses to the country. And collaboration with healthcare workers, NGOs, humanitarian organizations, and the military helped get shots into arms. Everyone pitched in, including neighborhood wardens like Han Kom Khan, a 71-year-old in Hanoi who helped answer questions from residents. Within months, 90% of Vietnamese adults were fully vaccinated. We've seen similar achievements in Kenya, Zambia, Colombia, Bangladesh, and many other countries where civil society, government, healthcare, philanthropy, business leaders have worked together. But we can't let up. We need more turnarounds like this, and we need them fast. So I urge all countries and donors here today to step up in getting vaccines to everyone who needs them, everywhere. Our interconnected health depends on it. Thank you.
Thank you, Secretary of State Antony Blinken, for your leadership, starting with hosting the launch event of the COVAX investment opportunity exactly 1 year ago. And we look forward to the COVID summit hosted by the US. We have just heard what has been done and achieved so far, but we need to keep building on this momentum to break COVID. Only through a renewed commitment to global cooperation can we move forward towards an even and equitable recovery. So I will now hand over to Edith, who will lead us through the next session on narrowing the equity gap to end the pandemic.
Well, thank you very much, Minister Schulze. So as we've heard from the global leaders who've spoken, COVAX was created to guarantee that everyone, regardless of income, would have equal access to COVID-19 vaccines. And this is why we all need to work together. In this context, let's first hear from the Prime Minister of Norway and co-chair of the ACT Accelerator, Jonas Gahr Støre.
Dear colleagues, friends, ladies and gentlemen, more than 2 years into the pandemic, we have to note the crisis is still not over. Despite the many other threats we are contending with, we must continue to address the most pressing health issue of our time. And vaccine equity is a priority. We will continue to be vulnerable to new surges of infection and the emergence of new variants until we reach high vaccination coverage everywhere. This now should be common knowledge. We must also provide support for testing, treatment, and public health measures. We have to acknowledge we are far from achieving our vaccine equity targets. 1/3 of the world's population has not yet received the COVID-19 vaccine. A full 128 countries are not on track to achieve 70% coverage. Some high-risk groups have not yet been vaccinated. So our key challenge now is delivery. Vaccines are not effective until people are vaccinated, obviously. But we can do something about it, and COVAX partners are addressing a wide range of bottlenecks and problems, from cold chains and vaccine hesitancy to marginalized populations and humanitarian settings. It is indeed a matter of urgency to secure full financing for the ACT-A accelerator and the COVAX facility. As co-chairs of the ACT-A Facilitation Council, President Ramaphosa of South Africa and I have called upon 55 countries to contribute their fair share. $15.2 billion are needed, including $5.2 billion for COVAX AMC. I would like to thank Chancellor Scholz for the recent German contributions to ACT-A and COVAX. Very helpful. Norway contributed $220 million to ACT-A in December 2021, including $56 million to COVAX AMC. Vaccine equity is critical to bring the pandemic to an end. And to achieve vaccine equity, we must fully finance ACT-A and COVAX for 2022. We can do it, so let's do it. Thank you.
Thank you, Prime Minister. You might be interested to know that as co-chair of the ACT Accelerator, Norway has played a critical role in advancing the fair distribution of vaccines, test equipment, medicine, and of course other healthcare services. We're now going to hear from Gavi's close partners and co-leaders of COVAX, the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, the Executive Director of UNICEF, Catherine Russell, and the CEO of CEPI, Dr. Richard Hatchett.
Excellencies, dear colleagues and friends, when we created the ACT Accelerator and COVAX 2 years ago, we knew that market forces alone would not deliver equitable access to vaccines and other tools. Despite many challenges, COVAX has now distributed more than 1.4 billion doses of vaccine to 144 countries and territories. And yet, the pandemic is far from over, and we still have a lot of work to do. More than 80% of the population of low-income countries are yet to receive a single dose of vaccine. We can only end the acute phase of the pandemic by supporting all countries to vaccinate 70% of their populations, with priority given to health workers, older people, and other at-risk groups. Reaching this target will save lives, reduce transmission, protect health systems, and reduce the risk of a new and more dangerous variant emerging. WHO and our partners are working with countries to turn vaccines into vaccinations as fast and far as possible. To reach our goal, we need a fully funded COVAX. Investments in COVAX are not simply investments in vaccines. They are investments in equity, in solidarity, in an inclusive global recovery, and a healthier, safer, fairer future for all of us. I thank you.
Honorable Ministers, Excellencies, ladies and gentlemen, since its inception 18 months ago, the Global Procurement, Shipment and Delivery Facility, that is COVAX, has delivered over 1.4 billion COVID-19 vaccines to 145 countries and territories. This achievement is nothing short of extraordinary. It has saved millions of lives. But we're still far from the finish line. The virus continues to circulate. A new variant has been detected every 4 months on average. Too many people are still becoming infected. Too many people remain unvaccinated. And too many countries are still struggling to vaccinate their populations against COVID-19. Most of these countries already face significant challenges, including conflict and chronic crises. The pandemic has strained fragile health systems to the breaking point. The impact on the most disadvantaged children is enormous. Disruptions in primary health services, routine immunizations, and education all threaten children's futures and the strength of their societies. The only true recovery is an inclusive recovery. We will not get to the finish line until everyone has affordable access to effective COVID-19 vaccines, tests, treatments, and personal protective equipment. And as we enter the pandemic's 3rd year, we have a historic opportunity to do more than deliver doses. It's time to help every country to turn vaccines into vaccinations by investing in health systems. We urge donors, member states, funding institutions, and the private sector to provide countries with the flexible, sustainable resources they need to respond to the pandemic now and to prepare for future health emergencies. This global community has come together as never before to respond to the pandemic. How we work together in the coming months will shape the legacy of the COVID-19 recovery. Let's make sure it's not a legacy of disruption and disparity, but a moment of catalytic change to build a stronger health system for everyone, everywhere. Thank you.
Good afternoon. More than 2 years into the pandemic, we are still seeing devastating surges in cases, hospitalizations, and deaths in many regions of the world. Yet hundreds of millions of people remain unvaccinated or undervaccinated, most of them in the global south. It is clear that the pandemic is far from over, so there must be no room for complacency. Ending the pandemic globally must continue to be a priority. The virus and its variants have proven to be a formidable and unpredictable foe, but we know COVID-19 can be tamed by the vaccines we have developed, where they are available. COVAX has proven its ability to get vaccines to those who need them. Now, it urgently needs support to accelerate vaccinations in the global south and to prepare for what the virus may throw at us next. COVAX now has sufficient supplies to support every country in the advanced market commitment to meet its national vaccination targets. We must seize this opportunity by providing lower income countries with the funding and support they need to quickly get more shots into arms. This will be the fastest way to protect those who remain unvaccinated and unprotected. But lessons must also be learned from the past. The virus will continue to mutate, but if new, additional, or variant-adapted vaccines are needed in the future, the global south mustn't be left at the back of the line again. Contingent funding for COVAX to purchase these vaccines, if it needs to, will help future-proof our response to COVID-19 and prevent a repeat of the tragic inequity we have witnessed to date. Thank you for your support. Our collective global health security depends upon it.
Thank you all so much for your commitment and, of course, support to COVAX. Let's now hear from the Minister of Health of Ethiopia, Dr. Leah Tadesse. Minister, over to you.
Greetings, distinguished participants of the COVAX AMC Summit. Like many countries, Ethiopia had to quickly adjust and respond to the COVID-19 pandemic, reviewing our approach frequently with agility as things evolved a lot. 2 years into this crisis, the issue has evolved from NPI and treatment to now vaccines, and within vaccines, I can say we have overcome the supply constraints and moved now to the challenge of COVID-19 vaccine delivery and uptake. At the heart of this shift is the success of the COVAX AMC-led effort, which has protected millions of lives from COVID-19 through the provision of fully subsidized vaccines to lower-income economies, and Ethiopia is fortunate to be one of these countries. But even if supply issues are better, still the vaccine equity gap is high, and to make matters worse, we are in a stage where global complacence towards COVID-19 is setting in. Partnering with Gavi, COVAX AMC, Ethiopia has been able to focus on prioritized action areas for greater equitable access in the country that contributed to the global vaccination efforts against COVID-19. As we always say, vaccines do not deliver themselves, so the COVAX Delivery Support, or CDS, has helped us enhance our vaccine management and delivery through procurement of new cold chain equipment. The COVAX facility has also moved to using demand forecasts to ensure Ethiopia gets the doses and types of vaccines it needs. This has enabled us to plan vaccine arrival to match our chosen implementation strategies while minimizing the risk of wastage. One other major shift we did was considering different delivery options that can help increase vaccine uptake, in addition to the main modality of routine immunization. This was particularly the use of campaigns, which has enhanced our uptake significantly in collaboration with COVAX and partners. The long-term goal is to move to more sustainable delivery approaches. With the assured supply of COVAX doses, we are now able to focus our efforts on other related areas such as demand generation, allowing the Ministry of Health intensify communication and community engagement in partnership with CSOs. This is expected to contribute to increased uptake this year. We need a combination of these efforts to ensure our access is better and our economies recover. The faster we can protect people in Ethiopia and everywhere, the better our chances are of preventing new deadly variants from emerging. So I strongly believe that support to COVAX from global and regional partners will assist countries to further reduce bottlenecks in delivery and accelerate uptake of COVID-19 vaccines while prioritizing and balancing routine immunization services. COVAX still has a crucial role to play in the pandemic response, and continued support to COVAX is important for AMC countries and the global community now more than ever before. Thank you.
Whose leadership, by the way, as chair of the COVAX AMC engagement group, has been critical to advance COVAX's mission of global equitable access to COVID-19 vaccines. Now, will you all please help me welcome the director of the One campaign in Germany, Stefan Exokrische.
Thank you for inviting me to this crucial event. COVID-19 hit us all, and it hit us hard. And we're still not out of the woods yet, while we're also battling the wider health, social, and economic impact of the pandemic everywhere. However, I am and always will be impressed by what we can achieve when we all pull together. The combination of scientific progress and political will to make the right investments at the right time meant that we were able to achieve nothing less than a miracle. It took us only 1 year to develop, test, and make available new and innovative vaccines against COVID-19. The best tools we have in this battle. Normally, this would take 10 years on average. In the words of the great Nelson Mandela, it always seems impossible until it's done. And now the next impossible challenge lies ahead of us. We need to ensure that everyone, everywhere has access to those tools. The aim? 70% of all people in all countries are to be vaccinated by mid-2022. And I urge you, the leaders of the rich countries, to show the same level of commitment that made the vaccine miracle possible. This is the only way to leave the pandemic behind us, once and for all. So in the spirit of Mandela, let's prove the doubters wrong once again by ensuring the COVAX initiative has the funding it needs to continue its crucial work that has already saved so many lives. Because none of us is safe until all of us are safe. Thank you, and back over to you.
Thank you, Director Exokrische. We're now going to hear how our civil society partners are reaching the most marginalized communities in a short Q&A session. We're joined by CEO of Amref Health Africa, Dr. Gethenji Gitahi, and the Senior Technical Advisor at Village Reach, Vudzai Magadzire. Dr. Gitahi, thank you for joining us today. Let's begin with you. You know, we now have a constant and stable supply of vaccines, but I'm wondering what it will take to reach communities furthest behind. And are there systems to reach communities grappling with multiple challenges that impact their access to COVID-19 vaccines?
As we start our third year of the COVID-19 pandemic, with more than 2 years of constrained supplies, which have now improved, we must remember that the pandemic is not over. Whereas many in the world have been protected through proper access to necessary COVID-19 vaccines, there still remain many amongst us, millions of them, who live in communities where they do not have access to COVID-19 vaccines, as they do not have access to other vaccines and commodities. But this can change. The pandemic is not over. We must remember the virus remains with us and the dangers remain. So we need to consider how to close the inequalities. As the COVID vaccine supply increases, how then do we ensure that it's not only about vaccines, but also about vaccinators and vaccinees? How do we ensure that we have the right workforce to ensure that everybody has access to vaccines everywhere and wherever they may be? This is why the Gavi COVAX Advanced Market Commitment is a necessary step in not only ensuring continued security of vaccines, but also ensuring that we reach the last mile by engaging civil society organizations to ensure that health systems are people-centered and that they are not only facilities, but there are health services reaching people where they live, where they work, and where they play. This is what we must keep in mind. Thank you.
Well, thank you so much, Dr. Gitahi, for those insights. And to you now, Ms. Magadzire, welcome. Now, I know that since Gavi's inception, civil society organizations have been recognized as key partners to reach communities with immunization services. And so, based on your experience, what are the comparative advantages that CSOs bring to the delivery of vaccines in low-income countries?
Civil society organizations, or CSOs, are important for COVID-19 vaccine delivery. CSOs are proximate to communities, and proximity allows them to do a number of things, including to identify and reach vulnerable communities. CSOs are familiar with the context, including the barriers to access, sociocultural and other dynamics that impact vaccination uptake. CSOs bring these valuable insights to the national or subnational task forces for consideration in design and execution of delivery mechanisms, ensuring that these mechanisms are tailored to the realities of communities. Proximity also allows them to gain the trust of communities. Often they're seen as a credible source of information. They can engage community leaders to attach value to vaccination, which is key for mobilization. CSOs also operate within flexibilities that allow them to adapt and scale quickly, an important attribute in a rapidly changing COVID-19 context.
Well, that's very interesting. And could you also explain the concrete activities that these CSOs perform at country level in support of COVAX?
The activities that CSOs have undertaken across the globe to complement government efforts in COVAX delivery are many. I'll highlight very few along three major themes of access, advocacy, and education. CSOs have played a major role in improving access. They have facilitated last-mile delivery in hard-to-reach areas, especially those affected by conflict and with minimal government presence. Through the humanitarian buffer, CSOs have distributed doses in countries where vulnerable populations aren't typically reached. We've also seen the introduction of high-volume sites in densely populated cities, as well as collaborations with ministries of health to strengthen supply chain performance and ensure essential products reach the last mile. In advocacy, CSOs have been providing information and data on the needs of key populations to better target support and advocating for the inclusion of vulnerable populations in national vaccination plans and campaigns. In education, CSOs have worked with a range of stakeholders on communicating COVID-19 information and curbing misinformation. Even as I highlight these milestones, the pandemic is not over and is still a global priority. All stakeholders have an integral role to play, and so do CSOs.
Well, thank you both so much for your contribution. I know that in a country like Kenya, which is where I come from, the critical work you do is really helping reach the most marginalized communities. Thank you for staying with us. We're now moving on to the next session of today's event, delivering on today's promises and protecting our future. Now, here we'll explore together what it takes to end this pandemic and be ready for eventual risks and shocks as the ones we've just seen. First, let's hear from one of the core members of the Gavi Alliance, the Vice President for Human Development at the World Bank, Mamta Murthy.
Hello. It's a pleasure to be participating in today's COVAX AMC Break COVID Now Summit. The World Bank has partnered with Gavi for many years and values its work to strengthen immunization services. We also recognize that Gavi's support to immunization contributes greatly to strengthening primary health care and health systems, support that is so badly needed in the world's poorest countries. In the past 2 years, we have partnered with Gavi on COVAX towards ending the COVID-19 pandemic. During this time, we found new ways of working together in support of countries that benefit from our comparative advantages. First, in order to increase COVID-19 vaccine supplies to AMC countries, we've worked together to develop a new financing mechanism that allows AMC countries to purchase doses beyond the fully donor-subsidized doses they already receive from COVAX using World Bank financing. Under this cost-sharing mechanism, 12 countries have secured nearly 20 million vaccine doses. Second, in order to accelerate the delivery of COVID-19 vaccines, our teams are working together to support governments in addressing deployment bottlenecks. For this, we coordinate closely at global and country levels under the COVID-19 Delivery Partnership. In Kenya, for example, World Bank financing, together with COVID-19 delivery support financing, supported a campaign in February that more than doubled vaccination rates. Now, we're at a moment where vaccine supplies to AMC countries have recently increased. But we agree that new, more virulent strains of this virus remain a risk, so having a contingency is important. On our side, we will continue to support countries to access World Bank financing to purchase more doses through the cost-sharing mechanism, should they choose to do so. Looking forward, we can reflect on the many lessons from COVAX and other innovative mechanisms and integrate these into an even stronger Gavi alliance. This will allow us to regain momentum towards ensuring equitable access to both COVID-19 vaccines and routine immunization, in particular in low-income countries and within vulnerable communities. COVID-19 has also reminded us that strong health systems and strong immunization capacity will be critical as countries prepare for any future pandemics. In this regard, we look forward to continuing our work together and strengthening our partnership with Gavi as we support countries to build resilient health systems for the future. Finally, many thanks to the G7, the G20, and the African Union for bringing us together today.
Many thanks to you too, Vice President Murthy, for the partnership and support. I'm glad you highlighted cost sharing. It's a really important new tool that leverages Gavi and multilateral development bank resources together and offers countries more choice and access to COVAX vaccines. And indeed, the two countries that we're about to hear from next have both been able to take advantage of the cost-sharing mechanism. We're now joined from Angola and Uganda by the Ministers of Health, Dr. Sylvia Lutukuta and Dr. Jane Ruth Aseng Osero. Shortly after, we'll be hearing from the Global Lead Coordinator for COVID Vaccine Country Readiness and Delivery, Ted Chaiban. Minister Lutukuta, over to you.
Angola has made important progress in fighting against COVID-19, having already administered nearly 18 million doses to protect around 20% of its general population and more than a third of the eligible population with 2 doses. To achieve these results, we are using combination of high-performance vaccination posts and the most populated areas with outreach vaccination teams in rural areas, with which we intend to gradually protect the population of all the communities and the vast national territory. Angola has invested heavily in activities related to the public information, capacity building, reinforcing of the cold chain, and implementation of individual digital registration of immunization. The vaccination campaign has the committed support of teachers, armed forces, police, as well as community-based organizations. All this would not have been possible without support of critical impulse of Gavi COVAX that complement national efforts and provided us COVID-19 vaccines, operational funds, and cold chain. The strengthening of vaccine storage system will extend its benefits for the immunization of children and women. To allow countries like Angola to continue increasing their COVID vaccination coverage, I'm calling on governments and donors to support COVAX to prevent countries like mine to fall back. The threat of disruption of global vaccination supply remains, as does the risk of new and potentially more dangerous variants emerging. Furthermore, we know that COVAX needs to raise $5.2 billion, which we hope will be achieved for the benefit of all of us.
I am honored to be a speaker today at the Gavi COVAX Advanced Market Commitment Summit. I would like to take this opportunity to thank Gavi, its donors, and all health workers in Uganda and across the world for a phenomenal job done in carrying out the COVID-19 vaccination exercise. Uganda has made good progress in vaccinating the priority population groups. It is quite true that deployment of vaccines to the beneficiaries is not easy, and it is not a cheap thing that can be afforded by many. We may not be able to increase the number of vaccinated people alone, and would require the support of the COVAX facility to do so. I take this opportunity to appreciate the COVAX facility for the support that has already been provided. I also want to thank the donors for their unwavering support to Gavi. All their efforts are not in vain, as the population deeply appreciates. In conclusion, I would like to thank Gavi and all their partners for the continued support to the immunization program in Uganda. And I wish you all very good deliberations. Thank you.
Excellencies, dear colleagues and friends, with over 700,000 confirmed cases reported to WHO in 24 hours as of 5 April, this pandemic is still far from over. Restrictions are being lifted around the world while the pandemic continues to affect countries in many different ways. We know that vaccines are a primary tool for reducing severe disease and death and getting us all closer to the end game. However, while vaccines are now available in sufficient quantities to vaccinate everyone everywhere, they are still not reaching millions of people that could benefit the most. Significant populations remain unvaccinated. The elderly, healthcare and other frontline workers, and people with underlying health conditions remain at high risk around the world, especially in low-income countries. Each country faces different challenges, but one common thread is the need for timely and sufficient delivery funding to get the job done. This comes first from domestic resources and the national budget, but additional resources are often needed to support incentives for health staff doing additional shifts, payment of surge staff for dedicated vaccination campaigns, mobile health teams to access hard-to-reach populations, the logistics and cold chains associated with decentralized vaccination efforts, and communications and community engagement activities to provide accurate information on the vaccines and increase demand. The COVID-19 Vaccine Delivery Partnership has been convened to focus on supporting amongst others, the 34 countries with the lowest coverage and some of the biggest challenges. We have already seen what good planning and dedicated delivery funding support can do. Countries can pivot fast to address bottlenecks and accelerate rollout. The $1 billion being mobilized for COVID-19 vaccine delivery through this appeal is key. The additional funding through COVAX can also be leveraged to enable countries to strengthen their vaccination programs and delivery systems, routine immunization, primary healthcare, now and for the future, contributing to better pandemic preparedness. We have a critical window of opportunity to make these investments and help accelerate COVID-19 vaccination. Thank you.
Thank you, Mr. Chaiban and the health ministers from Angola and Uganda. It's now my pleasure to introduce three of Gavi's key donors and leaders in global health. The Minister for Asia and the Middle East at the Foreign, Commonwealth and Development Office of the United Kingdom, Amanda Milling, the State Secretary for International Development Corporation of Sweden, Jenny Olsen, and the CEO of the Bill and Melinda Gates Foundation, Max Sussman.
Chancellor Scholz, thank you for bringing us together. Although the COVID-19 pandemic has been a time of great pain, it's also been a time of huge progress and global cooperation. We started out with no vaccines, but thanks to an immense development and manufacturing efforts, supplies are rapidly increasing. The UK played a critical role in this progress. The UK is amongst the largest donors of the Advanced Market Commitment, committing £500 million and donating vaccine doses. This has helped COVAX to support countries in delivering national vaccination targets. Now, this must be the year that we consign the pandemic to history. Together, we face three key challenges. First is getting vaccines to everyone who needs them. Here, I welcome the Vaccine Delivery Partnership, which is improving coordination at a local and international level. The second challenge is setting the wheels in motion to manage COVID-19 in the long term. That means focusing on surveillance, treatment strategies, and more resilient public health systems. The third is making sure that we're ready to respond to any future variants that emerge. Last month, the UK hosted the Global Pandemic Preparedness Summit in support of this, raising more than $1.5 billion to develop new vaccines and accelerate global production. I also welcome the new COVAX financing instruments, which can be used to make funds available quickly if needed. The UK will continue to help countries in need because no one is safe until everyone is safe. We have made great progress and now we must keep up the momentum. Thank you.
Excellencies, ladies and gentlemen, the pandemic is not over. For over 2 years, it has had a devastating impact on people, families, and societies. And only last week, it caused over 40,000 reported deaths. Thanks to tremendous work by nurses and factory workers, scientists and truck drivers, and many more, 2/3 of the world's population has now received at least one vaccine dose. This work saves lives. COVAX has played a critical role to enable better vaccine access, and Sweden remains a reliable partner and a firm supporter. Today, our focus must be on vaccination, including logistics, health systems, and perhaps most importantly, people's motivation to get vaccinated. I welcome COVAX's reinforced emphasis on vaccinations. Sweden stands ready to support your work in this area in various ways. To date, Sweden has committed $280 million and over 10 million donated vaccine doses. This makes us one of the leading COVAX contributors per capita. We will continue to share available vaccine doses, and we count on COVAX to continue to facilitate a fair and effective distribution, allowing us as far as possible to utilize valuable doses. Vaccine inequity is unacceptable. Next time, we can and we must do better. Even as we continue addressing the current pandemic, we must learn the lessons and work together to ensure the world is better prepared for future health threats. Thank you very much.
Thank you, Minister Schulze, for hosting this very important summit
and for your government's generous contributions to Gavi and the COVAX Advanced Market Commitment. The Bill and Melinda Gates Foundation shares your vision of a healthier, more equitable world, and we look forward to the progress that's possible under Germany's leadership of the G7. We're proud to be a founding member of Gavi. 23 years after our first pledge, Gavi is our largest grantee because we believe that everyone should have access to life-saving vaccines no matter where they live. The last 2 years only reinforced that belief. This pandemic ruthlessly exposed weaknesses in our health systems and tested both cooperation and fairness around the globe. It also proved all our fates are connected and that we can make the biggest impact when we work together. With COVID-19, scientists, regulators, and health providers moved faster than ever before from identifying a disease to being able to inoculate against it. Our foundation has pledged more than $200 million to the COVAX AMC and more than $40 million to support the delivery of vaccines as part of our more than $2 billion commitment to the COVID response. But many more lives could have been saved if vaccines had been distributed equitably. Modeling from Northeastern University showed that if some lower-income countries had had the same access to COVID vaccines as higher-income countries, they could have averted 70% or more of their COVID deaths. As we look forward, we need to listen to countries about what they need to manage COVID while addressing urgent local health needs. We cannot end this pandemic at the expense of other critical priorities, especially in areas where we've lost ground over the last 2 years. We need to resume critical services like routine immunization, and we need to invest in long-term solutions to strengthen primary healthcare systems which protect the most vulnerable from ongoing epidemics and make the world more resilient to future shocks. If we make the right choices now, we can end this pandemic and help prevent the next one.
Thank you, Mr. Sussman. As you say, we do need to invest in long-term solutions, protect the most vulnerable, and also make the world more resilient to future shocks. Let's now consider the innovative options we can use to create stable supply adapted to future challenges in 2022 and, of course, beyond. And for this, I'm pleased to introduce the CEO of the U.S. Development Finance Corporation, Scott Nathan. Scott, good to have you.
Thank you, Edith. As Secretary Blinken previewed, I'm proud to announce DFC's $1 billion rapid financing facility with Gavi in support of the COVAX Advanced Market Commitment to accelerate access to COVID vaccines. DFC's financing is a powerful tool, one that will maximize funding and minimize wait times for the seamless purchase, allocation, and delivery of vaccines across the developing world. Congratulations to Gavi. We're thrilled to be supporting this effort.
Right. And if you'll let me ask you a couple of questions, just stay with us. And first, I just want to know what prompted the US DFC to provide this new facility in support of COVAX.
Well, DFC is the development finance institution of the United States. We partner with the private sector to finance solutions to the critical challenges facing the developing world. Less than 3 months after our agency was launched, COVID hit. DFC responded by funding transactions to help the developing world provide essential health services and later access to vaccines. The work we did last year with Gavi is already helping mitigate risk and overcome financial hurdles for governments that are funding vaccine purchases through the COVAX facility. But 2 years after the world first went into lockdown, vaccine rates remain too low across many developing countries, especially in Africa. Simply put, it's clear there is more work to do. DFC's $1 billion rapid financing facility with Gavi will enable faster COVID vaccine purchase and delivery for lower-income countries. It will allow Gavi to monetize pledges made to COVAX as soon as donors make them, leading to much more immediate response times.
And how do you see this facility fitting into the larger role DFC sees for itself in pandemic response and, of course, global health?
Well, this pandemic highlighted the need for innovative solutions and for significant investments. Even after life-saving vaccines were developed, we had to scale production and speed up delivery. This facility represents our largest healthcare transaction ever. This massive investment matches the size of the challenge. DFC's strong partnership with Gavi advances the Biden-Harris administration's efforts to ensure more countries can acquire life-saving vaccines to help end the pandemic and prepare for future health crises. More broadly, DFC is committed to building resilient health systems through continued investments in healthcare, services, and infrastructure, supply chains, and digital health.
And so where do you think the opportunities for innovating financing in global health lie?
COVID is just one of many health challenges the world is facing. Much of the world lacks access to medical equipment, diagnostics, and therapeutics, as well as the basic necessities like clean water and good nutrition. These challenges require significant investment that exceeds the current resources of many governments. In partnership with public and philanthropic donors, DFC is exploring innovative financing solutions such as blended finance funds or development impact bonds to help absorb risk and attract more private capital for global health. Technical assistance can also complement debt and equity financing to ensure financial viability and development impact. Gavi has been a leader in the development of innovative financing for global health. And as we've seen with COVID, the world's health challenges transcend borders. And to build a healthier world, we need more global partnerships like this one with Gavi.
Right, absolutely. Well, thank you so much, Mr. Nathan. We're now going to hear from the President of the European Investment Bank, Werner Hoyer, followed by the Chair of the IFIM Board, Ken Lay.
Thank you. Herr Bundeskanzler, Excellencies, ladies and gentlemen. As President of the European Investment Bank, it's an honor to join you today for this timely Gavi COVAX AMC summit. 2 years ago, only a month after COVID was declared a pandemic, countries from around the world came together to create COVAX with the aim to ensure equitable access to upcoming COVID-19 vaccines. This unprecedented global response to the pandemic has since enabled COVAX to deliver over 1.2 billion vaccine doses around the world, ensuring that people living in developing and emerging economies are protected and lives saved. This was not an easy task. COVAX AMC has delivered and overcome export bans, competition for vaccines, and immense logistical challenges. It has demonstrated firmly how global and multilateral solutions can deliver vaccinations at scale to the world's most vulnerable communities. As part of Team Europe, we at the European Investment Bank are proud to have enabled 900 billion euros of financing to back COVAX AMC. José Manuel, Seth, your teams have made an amazing and humbling contribution to world health over the last 2 years. My sincere congratulations. However, as you and your experts have highlighted in many discussions with us, we must not stop here. We need to continue to secure new investment to create a global pandemic vaccine pool, to bolster the world's defenses against new COVID variants, to enhance countries' absorptive capacity to administer vaccines, and to cover the related logistical costs so that donated vaccines arrive in countries ready to be administered. Without continued vaccinations in all countries, rich and poor, a new variant risks looms at the horizon. I'm pleased to announce a pledge of an additional 1 billion euro of EIB financing, subject to approval from the EIB's EU27 shareholders, to contribute to ensuring that Gavi COVAX AMC is fully equipped to respond to this challenge. This funding will allow Gavi to front-load additional capital, support the pandemic vaccine pool, improve supply of vaccine doses at the time of need, and strengthen logistical efforts to deliver vaccines. Importantly, our funding will also support the procurement of doses from local manufacturers, in particular in Africa. At the EIB, we are pleased to respond to this important call. Thank you very much.
Last year, IFIM raised $1 billion in international capital markets to help fund the COVAX AMC. This surge of resources was raised using the pure play vaccine bonds that are IFIM's signature financing vehicle, backed by 10 donors' generous forward pledges. But we're here today, of course, to prepare for the future. We need the peace of mind that Gavi has the agility and resources to respond to the next emergency. At the pace at which these situations unfold, there is little time to spare. With this in mind, Gavi and IFM donors have identified an additional way to provide rapid, large-scale financing for the AMC and to help fund a new pandemic vaccine pool. This addition to the IFM toolkit will enable donors to make contingent pledges, which IFM would call only if needed to fight COVID-19 surges and variants or even new pandemics. IFM contingent pledges would have two phases. In the unactivated phase, the pledge would be on standby, aiming for zero current impact on a donor's budget. The activated phase would start once a major outbreak or pandemic triggers the pledge. If that happens, IFM could recognize the new assets in the donor's pledge and raise the corresponding funding on the capital markets. This would deliver immediate funding to the COVAX AMC with no gaps or lags. The contingent pledge feature builds on IFM's 15 years of experience front-loading funding through the capital markets to support immunization. And we believe it can contribute substantially and very efficiently to the nearly $3 billion in standby resources proposed for pandemic response. We're very much looking forward to finalizing this option with Gavi, with donors, and with IFM's Treasury Manager. Thanks.
Innovative finance is at the heart of COVAX's and Gavi's working model and allows us to be ready for future variants. On this note, I'd like to invite Michael Anderson, CEO of MedAccess, and Catherine Cax, Acting CEO of Soros Economic Development Fund, on how they're helping Gavi get as much value for money when it comes to donor cash. So let's start with you, Mr. Anderson. What is MedAccess, and can you explain how you've been working and have worked with Gavi in the past?
Thanks very much, Edith. MedAccess is a social finance company. We're founded by British International Investment and therefore funded by UK aid. Now, we're an investment firm, but with a difference, because rather than seeking to generate profits, we're seeking to generate improved access to affordable healthcare products that are effective, specifically for people in lower income countries around the world. So that's why supporting vaccines falls right into what we do. We provide financial guarantees to manufacturers, and we work with them to improve the volumes of what they can produce and sell, and to bring their prices down, take products into new markets they've never worked with before. We also provide finance for purchasing bodies such as Gavi and national governments and patient groups, so that they can take out some of the risks in the supply chain and help get products to patients faster and more effectively. I'm really pleased to say we've had a good partnership with Gavi over the last 2 years, and also with GSK on supporting continued production of the critical RTSS antigen, which is at the heart of the new malaria vaccine. And we were really pleased last year at the end of 2021 when the World Health Organization and Gavi took decisions to roll out the world's first malaria vaccine program, in part with financial support from MedAccess playing a big role in these big titans.
Great. And so to Ms. Cax, I'm curious, what prompted the Soros Economic Development Fund to create this facility with COVAX?
So this significant guarantee will help AMC countries purchase extra vaccines through COVAX, including variant-adapted vaccines to respond to future risks and shocks. It is incredibly important that these countries have a sustainable access to vaccines at the best possible prices.
Vaccines at the best affordable prices. And to Mr. Anderson, same question for you. What motivated MedAccess to create this facility with COVAX?
Well, we've seen with COVID, we've seen amazing scientific innovation, incredibly manufacturing innovation. We've seen the world pull together. But a key part of the response is also getting really good financial response. There are trillions of dollars in the world. We need to make sure that they are mobilized at the right time in the right way so that finance doesn't get in the way of patients securing what they need. And this was an opportunity to ensure that countries could choose the vaccines they wanted. And that's a critical part of pandemic response.
And now a question for the both of you. Ms. Cox, we can start with you. What are the opportunities for innovating financing, and can there be guarantees in global health and pandemic preparedness?
So absolutely, I think that this instrument demonstrates that there's a need for impact investors to take more risk. And we really hope that by investing in this, that we can encourage more impact investors to elevate their tolerance for risk in pursuit of outsized impact.
Mr. Anderson?
Yes, well, as Catherine mentioned, the guarantee we're announcing today will enable countries to get access to the vaccines that they choose, including the vaccines for new variants. So in some ways, this is pandemic preparedness already. And we've learned a lot from COVID over the last couple of years. We've built new tools, new systems, and we need to build on that learning to make sure we have robust systems in place, including the right kind of innovative finance to ensure that people can respond quickly and nimbly to new pandemics once they come along.
Well, I thank you both for your time and giving our audience an excellent understanding of your organization's work and also your collaboration with Gavi. And now joining me today right here in Geneva, I tell you what a pleasure it is to finally have some company in studio. I'm pleased to welcome the CEO of Gavi, Dr. Seth Berkley. Now, Dr. Berkley, we've heard that a lot has been achieved, but we're not done yet. So over to you so you can tell us about the pandemic vaccine pool and why this is so important if we're to break COVID.
Thank you, Edith, and thank you, Chancellor Scholz, for hosting this event with your co-host, President Sall and President Widudu, and to everyone sharing your experiences and insights on COVID and how we can better prepare for the future. As countries with high vaccine coverage reopen their societies, there is a growing perception that the COVID-19 threat is over. We all wish that were the case. At the same time, the focus is now beginning to shift away from COVID response towards preparing for the next pandemic. It is never too early for pandemic preparedness, but with more than 8 million new COVID-19 infections each week and more than 25,000 new deaths, it's important to remember that we are still in a state of global crisis. It is not clear if the worst is behind us. So even in the face of other pressing global crises like Ukraine, COVID must also remain a global priority. Thanks to COVID-19 vaccines, the risk of severe disease and death has declined, but the threat of resurgences and of potentially more dangerous variants still looms over us. So far, a new variant of concern has emerged on average every 4 to 5 months, and there's no reason to believe that this pattern won't continue. That means we must continue to adapt. That's why we're here today, to launch the pandemic vaccine pool, to ensure that the progress and investments we have already made are not derailed. Because ensuring people are protected in all corners of the world is the only way to end COVID. Today, 43% of people in lower-income countries are now protected with 2 doses. Much of this is thanks to the global effort led by COVAX, supported by many of you, which has delivered more than 1.4 billion doses so far. With nearly 90% of those doses going to lower-income countries through the Gavi COVAX Advanced Market Commitment, or AMC, and with our delivery support, the number of countries with coverage of less than 10% has dropped from 34 in January to just 19 in the last 3 months. However, many AMC countries are still struggling to roll out vaccines fast enough. Their citizens and the world remain at risk. It is as a global community that we are now in danger of seeing further shocks. We may see constraints to vaccine supply, perhaps the need for additional coverage, or very possibly the need for new variant-specific vaccines. Many uncertainties still hang over all of us. That is why we need the pandemic vaccine pool, so that, like many wealthy countries, COVAX has the ability to continue to adapt to such uncertainties, to ensure that there is equitable access to new vaccines as the pandemic evolves. This is what it will take to ensure that the poorest countries are not left at the back of the queue again, so that together we can finish the job. That's why today's investment opportunity for this new phase of COVAX and the package of innovative financing solutions discussed is so essential, to provide countries with the support they need to scale up their delivery systems, increasing absorptive capacity and demand so that they can achieve their targets, to ensure they get the right vaccines in the right volumes at the right time, and to provide support for ancillary costs such as syringes, transportation, and insurance to make sure donated doses reach people. Turning vaccines into vaccinations in some of the world's poorest and hardest to reach settings was always going to be one of the toughest challenges of the world's largest and most complex vaccine deployment ever. This new phase laid out here today will help us achieve that and protect the lives of hundreds of millions of people in the process. And by building on more than 20 years of success across the alliance, helping countries to create stronger and more resilient health systems, prevent outbreaks, and protect the most vulnerable from infectious disease, it will also lay the foundations for future pandemic preparedness. I'd like to thank all of you for coming here today and for your ongoing support to break COVID.
Well, thank you so much, Dr. Berkeley. And as you say, it's so important that we heed the lessons we've learned and prevent vaccine iniquity from happening all over again. I'll now hand you over back to Minister Schulze to guide us through the pledging session.
Thank you, Edith. Now the moment is you all have been waiting for, where countries come together to announce their commitments to COVAX. We have several high-level interventions coming up shortly. First up, let's hear from the Prime Minister of Canada, Justin Trudeau, followed by the Prime Minister of Iceland, Katrin Jakobsdottir, and the Prime Minister of Luxembourg, Xavier Bettel.
Hello, everyone. Bonjour à tous. Thank you to Chancellor Scholz, Olaf, and Gavi for hosting the 2022 COVAX AMC Summit. Les 2 dernières années ont été très difficiles. La pandémie a changé la vie des gens partout. Et même si bon nombre de nos pays assouplissent leurs restrictions, la COVID-19 est encore bien présente. Our collective aim must be to increase access to COVID-19 vaccines and other medical countermeasures so that every country has what it needs to protect its people from this virus. Together, we've made progress over these last 2 years. COVAX has delivered over 1.4 billion vaccines to 144 participating countries. That's a remarkable achievement, but our job isn't done yet. Nous devons améliorer l'approvisionnement, la livraison et la gestion des dons. Nous devons nous assurer que les pays peuvent avoir un approvisionnement stable en vaccins et que lorsque des doses arrivent à l'aéroport, les pays ont le soutien financier, opérationnel et technique dont ils ont besoin pour que les gens se fassent vacciner. Canada has played a leading role donating millions of doses and will continue to do its part to support COVAX. And today, I can announce that Canada will commit an additional $220 million to the COVAX facility. Since the start of the pandemic, we've known that in order to truly beat COVID-19 anywhere, we have to beat it everywhere. The work we're doing, together with the COVAX facility and all ACT Accelerator pillars, is the best way to get vaccines to countries who need them most and beat this pandemic. La générosité que la pandémie a révélée en chacun de nous m'a inspiré. Continuons sur cette lancée alors que le moment est venu de soutenir nos systèmes de santé, de promouvoir la relance économique et d'éliminer la menace de la COVID-19. Encore une fois, merci de m'accueillir.
Dear colleagues,
I am pleased to join you here today as we reaffirm our commitment to closing the global COVID-19 vaccination gap. While we have managed to get a hold of the pandemic through vaccinations in the wealthier countries, the vaccination rate in many developing countries is still staggeringly low. Because of this, people in poorer countries are more susceptible to the virus and to serious illness caused by it, which in and of itself is deeply unjust. This also increases the chances of the virus mutating into new variants, which can have devastating effects all over the globe. COVAX and the broader ACT-A partnership have played an instrumental role in organizing multilateral cooperation for vaccine equity. Since its launch almost 2 years ago, Iceland has contributed around 1 billion Icelandic kronas to COVAX. Today, it is my pleasure to announce that Iceland will contribute another 250 million Icelandic kronas to COVAX in 2022, bringing our total contribution to 1.25 billion Icelandic kronas. Iceland's contributions to COVAX represent our firm belief that to fight the global crisis of COVID-19, we must have strong international and multilateral collaboration. And a big thank you to the government of Germany and Gavi for bringing us together here today to discuss this important topic.
Dear colleagues, though virtually it's my great pleasure to join you at the 2022 Gavi COVAX Advanced Market Commitment Summit. During the 2021 summit, I already had the pleasure to join my voice to that of other leaders calling to strengthen global solidarity in vaccine sharing. Since then, tremendous progress has been made, with almost 1.2 billion funded and donated vaccine doses provided through the Gavi COVAX AMC to lower income countries. However, we are well aware of the remaining discrepancies between high income and low income countries on access to vaccination and of the end to build and strengthen resilient and sustainable systems for health worldwide. We have to persist in our efforts, and despite other challenges that we are currently facing, now is not the time to disengage. New emerging variants make the pandemic's evolution unpredictable. We need to act now and build on current progress to strengthen delivery systems and enhance preparedness to every possible scenario of the pandemic's evolution. Therefore, I want to thank all frontline workers for their continued efforts and reiterate my appreciation to the international community for establishing multilateral platforms like the COVAX AMC to guarantee vaccine dose donations and supply to the countries in need. Luxembourg is entirely committed to break COVID now and will support the COVAX AMC with €1 million, which comes to in addition to the €4 million we have committed to COVAX AMC until now. The urgent need for increased solidarity and strengthened collaboration with all stakeholders remains more important than ever to leave no one behind. Thank you.
Thank you for your commitments to COVAX. This funding is essential for COVAX to continue its work in this year and beyond. And now let's hear from the Minister of Foreign Affairs of Australia, Marise Payne, followed by the Minister of Health of Brazil, Marcelo Queiroga, the Commissioner for International Partnership, European Commission, Jutta Urpilainen, and the Foreign Minister of France, Jean-Yves Le Drian.
Hello from Australia. May I acknowledge Minister Svenja Schulze, Germany's Minister for Economic Cooperation and Development, Professor José Manuel Barroso, the Board Chair of Gavi, distinguished ministerial colleagues, ambassadors and excellencies. I'm pleased to join you at the 2022 COVAX Advanced Market Commitment Summit. I thank the German government for hosting this important event and acknowledge Germany's leadership and focus on global health security as current chair of the G7. COVAX AMC has so far delivered over 1.2 billion vaccine doses, helping to save lives, prevent unnecessary suffering and mitigating pressures on fragile health system. COVAX has delivered for us all under challenging circumstances, including new variants and an ever-changing supply and demand landscape. Thanks to the combined efforts of Gavi, CEPI, the World Health Organization, governments, researchers and the pharmaceutical industry, we now have a strong supply of safe and effective vaccines. But our job is far from done. Determined and coordinated efforts to deliver doses to those who need them most must be continued. Focused on that ongoing effort, the Australian Government has allocated half of our vaccine access funding for the Pacific and Southeast Asia. We must also be prepared for the emergence of future COVID-19 variants or other, as yet unknown pathogens with pandemic potential. The Australian Government has recently announced funding of $375 million over 5 years for a second phase of our health security initiative in the Indo-Pacific region. As part of our commitment to supporting the next phase of the global pandemic response, I'm pleased to announce that Australia will provide a further $85 million to the COVAX AMC, bringing our total contribution to $215 million. We will also offer at least 10 million vaccine doses to COVAX from Australia's supply. Australia will continue to make every effort within the global community and in our own region to end COVID for all and to support our shared recovery. Thank you.
Senhoras e senhores, como Estado-membro fundador da COVAX Facility, o Brasil reconhece seu importante papel na promoção do acesso justo e equitativo a vacinas contra a Covid-19. No enfrentamento à atual pandemia, o Brasil se orgulha de realizar a maior campanha de vacinação de sua história. Isso somente é possível graças à capilaridade do nosso Sistema Único de Saúde e à forte cultura vacinal dos brasileiros, que gozam de liberdade para aceder a mais de 38 mil salas de vacinação em nosso extenso território. Desde o início da pandemia, temos buscado fortalecer o nosso complexo industrial da saúde. O Brasil é um dos poucos países no continente americano com know-how e capacidade instalada para a produção de vacinas em larga escala, entre as quais destacam as vacinas contra a febre amarela que fornecemos à Gavi. Além das ações promovidas em âmbito nacional, o Brasil vem se engajando na ampliação do acesso global por meio de doações que já somam 5,6 milhões de doses de vacina contra a Covid-19. Neste ponto, é com grande satisfação que anuncio que o governo brasileiro poderá efetivar a doação financeira de até 86,7 milhões de dólares à COVAX AMC. Essa nova contribuição é prova do engajamento e compromisso do Brasil com a realização do direito à saúde para todos. Muito obrigado.
Dear friends, in every marathon, there is a last mile, a final push to get across the finish line. We all hope we have reached the last mile in the battle against COVID-19. Today, vaccine supply matches demand and countries can choose the type and timing of delivery. The European Union is proud to have supported the creation of COVAX and contributed already 1 billion euros to its success. Together with our member states and financing institutions, the Team Europe is close to 4 billion euros. Today, 87% of the vaccines donated by the European Union member states, more than 400 million doses, are channeled through COVAX. Yet, the race against COVID-19 is not over. The war is back in Europe, but we will not turn our backs on other crises and on our partners. On the contrary. More than 2 years in, just 15% of Africa's population has been fully vaccinated. Supply is no longer the problem, administration is. And that is why the EU and its member states have contributed 1 billion euros to support vaccine rollout. I am pleased to confirm that European Commission is allocating today an additional 75 million euros to COVAX to help resolve vaccine rollout issues in the African countries with the lowest vaccination rates. And we are actively identifying further funding for a comprehensive response covering supply, ancillary and delivery. Because when it comes to ending this pandemic, it does take the last mile. And you can count on Team Europe.
Monsieur le Président Barroso, Mesdames et Messieurs les ministres, Mesdames et Messieurs, avec ACTA et COVAX, nous avons su construire ensemble une réponse multilatérale, solidaire et efficace à la crise pandémique dans laquelle nous sommes plongés depuis maintenant plus de 2 ans. Grâce à notre engagement commun, plus de 1,4 milliard de vaccins ont pu être livrés dans 144 pays. Et le vaccin est aujourd'hui très concrètement en passe de devenir un nouveau bien public mondial conformément à l'objectif que nous nous sommes fixés. Mais beaucoup reste à faire, notamment pour relever partout le défi du dernier kilomètre et pour nous préparer au choc qui pourrait nous frapper demain. Ensemble, nous devons donc donner à COVAX tout à la fois les moyens de poursuivre son travail de terrain dans la durée et les moyens de faire face sans délai à tout rebond de l'épidémie. C'est le sens de cette rencontre. Le combat pour l'accès équitable et universel aux vaccins contre le Covid-19 passe aussi, bien sûr, par le combat pour la souveraineté sanitaire des pays du Sud, qui doivent pouvoir disposer de leur propre capacité de production vaccinale. La France et les Européens sont à leur côté. Au Rwanda, au Sénégal ou encore en Afrique du Sud, où nous appuyons la construction de hubs de production de vaccins à ARN messager, mais aussi à l'OMC, où des progrès décisifs viennent d'avoir lieu en vue d'un compromis autour des enjeux de propriété intellectuelle. Nous devons poursuivre dans cette direction ensemble. Dans le cadre d'ACTA, nous devons aussi rester mobilisés pour renforcer les systèmes de santé des pays les plus fragiles, car, et cette pandémie l'a montré, il y va de notre santé à tous. Je vous remercie.
Thank you for your support and your pledges. The leadership of the European Commission and France have been critical in creating the ACT accelerator and supporting both COVAX and the dose sharing mechanism. We will now hear from the Minister of Foreign Affairs of Liechtenstein, Dominic Hasler, and the Minister of Foreign Affairs of Spain, José Manuel Albares.
Mr. Chair, I wish to commend Germany and the COVAX Advanced Market Commitment for organizing today's summit. Let me congratulate the Gavi COVAX AMC for delivering over 1.2 billion doses of multiple vaccine products to 92 lower-income countries. Liechtenstein considers this as an important milestone, but much more needs to be done to reach the most vulnerable. In light of our shared belief that no one is safe until everyone is safe, today's summit serves as a prime opportunity to redouble our efforts to ensuring equal access to vaccination. Liechtenstein is committed to the principle of solidarity and has therefore contributed a total of 600,000 Swiss francs to COVAX AMC. With this contribution, around 120,000 doses could be purchased and distributed by COVAX. This is about 3 times the population of Liechtenstein. Let me wish you a successful summit and assure you Liechtenstein's continued support. I thank you.
Agradezco al Gobierno alemán y al Fondo de Acceso Global para Vacunas COVID-19 COVAX la organización de este encuentro, que retoma el gran trabajo realizado por la cumbre virtual Gavi COVAX Advanced Market Commitment de Japón. Vivimos tiempos marcados por la agresión ilegal de Rusia a Ucrania, que se ha unido a las muchas crisis humanitarias ya existentes. A todas ellas debemos sumar el COVID-19. Hemos progresado mucho, pero todavía nos queda camino por recorrer para asegurar una distribución equitativa de la vacuna, así como de los tratamientos, en los países en vías de desarrollo. La tasa de vacunación mundial ha aumentado notablemente este año. Asimismo, la producción mundial de vacunas ha crecido lo suficiente como para poder contribuir a la demanda mundial. Hoy en día, todos los presentes somos conscientes de que nuestro principal desafío es aumentar la capacidad de absorción en aquellos países donde la vacunación progresa más lentamente. Únicamente realizando un esfuerzo colectivo y enfrentando la pandemia de manera integral, conseguiremos llegar al objetivo declarado en la última cumbre de líderes del G20 de vacunar a al menos el 70% de la población mundial este año. Las campañas de donación de vacunas deben ir acompañadas de políticas de cooperación para fortalecer la infraestructura y las cadenas de frío para que las vacunas puedan llegar a las zonas más remotas, aumentar la formación y los medios del personal sanitario y luchar contra la desinformación. La Agencia Española de Cooperación Internacional al Desarrollo ha puesto en marcha este 2022 el programa COVID-19, destinado a financiar proyectos en 14 países para enfrentarse a la pandemia. Desde el inicio, España ha estado comprometida con el sistema multilateral para superar la pandemia del COVID-19 y, en particular, con ACTA y COVAX. Creemos que el trabajo realizado por esta alianza ha sido esencial para repartir de manera equitativa los medios para hacer frente a una enfermedad que no conoce fronteras. Y bajo el espíritu Team Europe, la Unión Europea, España y todos sus miembros hemos colaborado de manera eficaz, demostrando que Europa está a la altura del desafío. Por ello, España ha puesto a disposición de COVAX más de 50 millones de vacunas, lo que nos ha permitido situarnos entre los 5 mayores donantes vía COVAX del mundo y el segundo mayor en Latinoamérica. Y nuestro compromiso continúa. El presidente del Gobierno elevó el pasado mes de febrero nuestra meta hasta los 70 millones de vacunas donadas en el reciente diálogo de alto nivel, promoviendo el impulso a la vacunación universal que organizó la Asamblea General de Naciones Unidas. España se ha convertido en estos meses simultáneamente en uno de los países con mayor índice de vacunación mundial y en uno de los mayores donantes de vacunas, contribuyendo de manera destacada a proteger al resto del mundo. En el plano financiero, España ha apoyado el Gavi COVAX Advanced Market Commitment desde el comienzo. El presidente del Gobierno comprometió 50 millones en 2020 y otros 50 adicionales en 2021. Este 2022 ya hemos movilizado 3,5 millones de euros y estamos trabajando con toda la Administración para aumentar aún más nuestras aportaciones. Entre todos, conseguiremos acabar con la pandemia en todos los rincones del planeta.
Thank you all. The COVAX AMC success depends on the highest level of leadership and international collaboration, so your support is crucial to making it happen. So next, let's hear from the Vice Minister of Foreign Affairs of Estonia, Andres Rundu, followed by the Vice Minister of Foreign Affairs of the Republic of Korea, Choi Young-moon, and the Regional Councillor for Foreign Action and Open Government of the Government of Catalonia, Victoria Alsina.
Dear colleagues, thank you Germany and Gavi COVAX AMC for organizing the event. After 2 years, COVID pandemic still remains a global challenge that requires our united and global response. ACT Accelerator and its vaccine pillar, the COVAX facility, have been instrumental in this global effort. Thank you, Gavi, for the great work providing such a significant number of vaccines through the COVAX facility to lower-income countries and territories around the world, which has narrowed the vaccine equity gap. We are happy to acknowledge that this year the vaccine production and supply meet the needs. Allocations are no longer driven by availability of vaccines, but needs and capacity to turn vaccines into vaccination. Increasing the absorption capacity in the recipient countries has clearly become the most pressing issue to achieve the goal: vaccinate 70% of the world's population by mid-2022. This requires increased support to the implementation of vaccination campaigns, including infrastructure, human resources, specific training of medical staff, as well as tackling disinformation and hesitancy. Estonia has contributed vaccines as part of the Team Europe contribution to COVAX with a value of more than €1 million. We made our contribution to COVAX AMC last year, and today I am happy to announce our additional pledge for 40,000 euros for 2022 to help support strengthening countries' delivery systems and capacity building. Thank you all, and I wish you a successful summit.
Good morning and good evening. Thank you, Chancellor Olaf Scholz, Mr. Jose Manuel Barros, and Mr. Seth Berkley for bringing us together for today's summit. Recently, many nations have relaxed their social distance measures. Yet, scientists warn that it is dangerous to assume Omicron will be the last variant. Indeed, we should stay vigilant and carry on with our vaccination campaign until AMC countries reach their own vaccination targets. Korea will continue to be the part of the global efforts led by COVAX to support the vaccination campaign. First of all, Korea will increase the supply of vaccines. Among them is the Novavax vaccine, which is contract manufactured by a Korean company, SK Bioscience, and submitted for WHO emergency use listing evaluation. As a pre-filled syringe model, it is easier to handle and use. It will contribute to accelerating vaccine coverage, especially in the regions lacking a reliable cold chain system. Secondly, Korea will focus on supporting the capacity building of developing countries, which is as critical as the supply of vaccines. This will help our partners secure equitable access to biologics and better cope with the current and future disease outbreaks. Thirdly, I would like to note that Korea has been designated as a host country of the WHO Biomanufacturing Workforce Training Hub. The Korean government will provide a training program for bio and healthcare professionals from developing countries. This year, 370 professionals will benefit from the program, mostly from low and middle-income countries. Our goal is to scale up the program to accommodate up to 2,000 participants per year. In my recent meeting with the Director General of WHO, Mr. Tedros, we reaffirmed our commitment for the success of this program and agreed to maintain close consultation going forward. In closing, one lesson from COVID-19 is that disease outbreaks call for global solidarity. In taking a globally coordinated approach, Gavi will play a key role, particularly in ensuring equitable and sustainable access to health tools. Korea will also continue to work with the international community to strengthen preparedness for future health threats at the regional and global level. Thank you.
Dear colleagues, I am very honored to represent the Catalan government in today's summit. I would like to emphasize Gavi's relentless work for an equitable distribution of vaccines around the world, especially targeting lower-income countries. Gavi's effort to accelerate global vaccination coverage have already given access to 1.2 billion COVID-19 vaccine doses in these countries. We have experienced the great change that vaccines can trigger, from full lockdown and collapsing health systems to reopening economies and lower hospitalization levels. However, although progress has been made, there are still challenges in our quest, indeed, to immunize the global population. Vulnerable countries lack proper vaccination coverage, and high-risk population remains still particularly unprotected. As the experts from Gavi Alliance demand, we still need to improve the delivery of existing vaccines and make our financing systems more flexible to respond to new risks. Vaccines are indispensable to guarantee COVAX's objective of reaching 70% of the global population vaccinated by summer 2022. Now that vaccines are available, no country can be left behind. As the Catalan Minister of Foreign Action and Open Government, let me publicly announce the government's new financial contribution of 290,000 euros to the mechanism in 2022. This contribution demonstrates once again Catalonia's commitment with both the multilateral system and the provision of global public goods. We must act together to prepare ourselves for potential challenges of the current and future pandemic. The pandemic is a global challenge that requires a global response. The Catalan government is convinced that COVAX is the right mechanism to articulate the response. Thank you very much.
Thank you all. Your strong support for the COVAX AMC is a reminder that COVAX offers the fastest, the most comprehensive way out of the acute phase of the global pandemic, and that we can only do it together.
Well, thank you very much, Minister Schulze. At this point in the program, we would have been hearing from the Minister of Economy, Planning and Cooperation of Senegal, Mr. Amadou Hott, as well as the Prime Minister of Mauritania, Mr. Mohamed Ould Bilal Messoud. Unfortunately, they're not able to join us because of some technical difficulties. We do, however, acknowledge their desire to participate in the summit and also thank them for their continued support and contribution towards COVAX. And now I'd like to hand over to Professor Barroso, who will give us his thoughts on today's event and the path ahead.
Thank you all so much for your incredible support and the commitments and pledges we have seen today to make this summit such a success. I'm delighted to confirm that in this summit we have received $3.8 billion in donor support and innovative finance, in addition to multilateral development banks confirming that $1 billion will be made available to countries to their vaccine purchases through COVAX. In addition to these $4.8 billion in commitments, there will be more commitments coming through, as we have heard today. That's really an impressive result. Thank you very much indeed. This renewed commitment will enable COVAX to protect its continued supply of COVID vaccines against supply shocks and bring us closer to countries achieving their national vaccination targets. This suite of innovative instruments and mechanisms will protect the lives of millions of people in lower-income countries by enabling the COVAX AMC to continue to adapt and respond to the needs of countries. Ultimately, that is what it will take to be certain that the worst is indeed behind us, so that life can soon begin to return to normal for everyone. I would like to close these proceedings by thanking you all again for these new important pledges and for your ongoing commitment to break COVID. If I may, a very warm and special word of thanks to Germany, to Chancellor Scholz and Minister Schulze. Without their commitment and leadership, these results would not have been possible. Thank you.
Thank you. Thank you very much. Excellencies, ladies and gentlemen, members of the donor communities. We are sending out a signal of global solidarity today. And together we have reached our target of mobilizing $3.8 billion in funding, plus $1 billion that is available from the multilateral development banks, the World Bank, the Asian Development Bank, the European Investment Bank. And we acknowledge the long-standing support of many other donors like Qatar to COVAX mission of equitable access. COVAX is the key element of our multilateral response to the pandemic, and with today's commitments, we underline the great trust that we are placing in this initiative. COVAX is and remains a success story. It is the fastest and biggest vaccination campaign in our history. COVAX is the central supply of vaccines for the world's poorest countries. It plays a key role in ensuring more equitable access to COVID-19 vaccines. And current infection rates shows that the pandemic is not over yet. So therefore, continuing our support for the global vaccination campaign in 2020 must remain our top priority. Nobody is safe until we are all safe. And the challenge keeps getting bigger. The COVID-19 pandemic is a polypandemic which not only affects people's health, but also brings it in its wake devastating economic, social, and humanitarian consequences all around the world. And that is why the pandemic vaccine pool, as an innovative and flexible financing instrument, plays a key role for pandemic prevention. It will help us be better prepared for future virus variants of concern, and we need to ensure fair access to COVID-19 vaccines, including in times of wars, crises, and unexpected shocks. And access also means effective vaccines logistics. COVAX provides support for the transportation of vaccines within partner countries, safe cold chain and local health institutions and their staff to make sure that the distributed vaccines get into the people's arms. The acute phase of the pandemic must be ended this year. Without today's commitments, we have made a major step towards achieving this goal. So thank you very much for all of you.
Minister Schulze, thank you very much. I have to admit that I'm very excited to hear about the possibilities of the future. As one of the recipients of these donated vaccines, I know all too well how important this summit and those commitments are. Well, we've now come to the end of today's COVAX AMC Break COVID Now Summit. It has been an immense pleasure for me to be with you today. And I'd like to thank you for taking the time to join us. And I'd also like to thank all our speakers for taking the time and to commit to this vital cause. From Geneva, I say to you, au revoir, auf Wiedersehen, and goodbye.